Well, in a busy practice, it's difficult to have enough time to ask as many questions as you need to or cover all the topics that you need to, and this allows me to be able to do that more rapidly with more information. It has helped me get more information from them because I know that when I would ask them questions before, I think they often held things back, and in this setting of being able to use an app rather than talk to somebody face to face at first, I think they're more honest, they give more information, and then I am able to know by the summary that comes up after the questions are answered what areas they really need counseling in or more information, advice. Well, I like that it is quick, it saves us some time, and I like that it gets a lot of information for us, but that the patients, I think, kind of enjoy doing it. They don't seem to mind at all, and it gives me the kind of information I need, you know, in a hurry. So. Well, here at our clinic, I needed to have it approved by administration, and then it was fairly easy for Lisa Rue to come out and show us how to use it. And then when we want to use it for a patient, it would be when they're having a physical exam, and when our receptionist calls them to schedule it or reminds them of the appointment, they will ask, can you come 10 minutes or so early, and would you be interested in filling out a relationship questionnaire, is kind of the way we put it. And they say yes. I don't think we've had, maybe one we've had that said no. They come in, they do it before I see them, and then I'm able to quick get the summary page up, and I can carry that right in with me on the tablet and talk with them. And you know, it wasn't too expensive to acquire the tablet to, you know, have that available. So I would say that it's really beneficial. I think that as preventative medicine is being emphasized more and more, especially around sexual health, that this will be a great tool, because we're asked to do all sorts of things during a physical exam, and this way you can do it quickly with more information, and you can also make a screenshot currently of the page that's the summary page on the app and print that out. I think eventually we'll be able to make it part of a medical record, and so it really makes it easy. So far, of the ones that I've done, it's about 50% primary risk, and then it looks like about 25% secondary and 25% tertiary. Well, I would just say I've worked with Lisa Rue for some time in one way or another in achieving these goals that I think now she is achieving with a product like this, and I think it's just super. And I want to keep supporting that, because I feel like it's important for our patients to have this information, for us to have the information we need to help them, and to be able to do as much toward prevention of STDs or pregnancies, or just, you know, terrible emotional trauma relating to relationships that they are not ready for. That's one thing I did want to mention, is you can pick up some information about whether a patient is happy with their current situation, so that you can counsel them to reestablish boundaries if they are not happy and not in a good situation. It can also pick up some on abuse, if they might be in an abusive situation as far as a sexual relationship. So all of those things are great about the product, and probably get us a lot more answers and honest, you know, information than we got before. So that's what I would say.